Hi, this is Dr. Bill Hayes with Sterling Ridge Orthopedics. I want to talk to you today about the most common cause of shoulder pain in adults. And the good news is it's usually treated non-operatively. So the diagnosis is impingement, and another term you may have heard is bursitis. And what happens is that over time, our shoulder gets a little weaker just with normal aging. And then this is normally what's called a humeral head depressor. And when it gets a little weaker, the ball migrates up just a little bit, and that allows or makes more predisposed the bursa to getting pinched here. So what that'll show up as is it hurts to take off your shirt. It hurts to reach for things. It hurts to scratch your back. Women, it hurts to get your bra strap. Those are common physical complaints, and we can treat that usually non-operatively. So the important thing is to get an evaluation to make sure you don't have a rotator cuff tear. Usually advanced imaging is not the first line treatment. Usually it's a subacromial injection we can do in the office. Second, I'll show you some stretches to do at home. And the third thing is a little bit of structured physical therapy. And those three things together give us about a 96% success rate in treatment of this. I want to show you guys some stretches that you can do for your shoulder that are easy to do at home. I always recommend for my patients to try them in the shower first with the hot water, but you can do this for bursitis, for rotator cuff tendonitis, for frozen shoulder. And just so you know, these stretches will help prevent pain. So when you have a stiff shoulder, usually it's an uncomfortable shoulder, and these are easy things to do in the comfort of your house. So if you imagine this is the shower, what I have my patients do at first, have the hot shower on, warm up, and then at first just roll your shoulders back to warm up, just to do this. And then also I'll show you here, just squeeze your shoulder blades together 4 or 5 times. And what that does, it just starts to wake up your scapular muscles. Okay, now we're ready to go. And then use if this is my hurt arm, use your good arm and bring the hurt arm up on the wall about 90 degrees, okay? And then step back, elbow nice and straight, and then just drop your body down so you feel the stretch in your underarm, but you're feeling it this way. But then the important thing, guys, is to take your chin and just touch your chest. And when you do that, and men, listen to me, hold your stretch more than 1 second. Dudes tend to not hold their stretch. So just try to hold it for 5 or 10 seconds, and then work your way up that wall, nice and slow, and then hopefully get up to where you're really doing that stretch. And what that's gonna do, guys, it's gonna stretch this capsule and help that ball sit down in the joint much better. And the other part, so when we're through with that and we're back to where we started, don't forget your bicep, because the bicep is a really significant pain generator. So just doing this stretch like that will really, really help that. Nice and slow, sustained stretch. You can bring your arm up a little bit more or a little bit lower, and you're gonna feel that stretch all the way here. And then finally, sometimes our therapists have you do this, and this is just a piece of PVC pipe. And if you want to do stuff at your house, you just get a piece of PVC pipe. You can be laying flat on your back, or you can do it in a chair, and basically just have the good arm start helping lifting the bad arm up like that. In summary, impingement or subacromial bursitis is a very common entity, very common diagnosis, but it can be treated successfully non-operatively.